Hello, I'm Tracy Williams, President of AfPP, the Association for Perioperative Practice. Today is Saturday and it's a bank holiday weekend. Many festivals are currently being celebrated or are approaching. Easter, Passover, Ramadan, Vlazaki to name a few. And normally we would be celebrating, but these are extraordinary times and usual customs and practice have changed. The COVID-19 pandemic has impacted on everyday working lives. The way we deliver care has changed. Routine elective surgery is suspended and perioperative practitioners, nurses, ODPs, healthcare assistants are being redeployed or asked to use their skills and knowledge in very different ways and situations they might not be familiar with. This is scary in itself, but we also have the added burden that we are exposing ourselves to risk every single shift. Personal protective equipment is available, but some supplies are limited and this is causing problems. To support this demand, companies not usually associated with the manufacture of clinical supplies are diversifying and are producing gowns, face shields and masks in an effort to support healthcare workers. This national response is fantastic. Similarly, healthcare workers themselves are responding. Students coming up for qualification, retirees and those no longer in clinical practice are returning to support care delivery. I've heard of a surgeon who's working as a nurse to make the best use of his skills. Operating department practitioners and theatre nurses are using transferable skills to support their colleagues in the intensive care units. Operating theatres and conference centres are being turned into intensive care units and high dependency facilities. These all need staff who are competent to deliver care and with access to the appropriate equipment to do this. The response to this pandemic is remarkable and we are all really proud of how we're doing this and coping. But it is at a cost. We're losing friends, family and colleagues to this disease. We're forced to live away from our families so that we reduce the risk of exposing them to the virus. Normal social interactions which would usually support us through this are being denied because of social distancing. More than ever, we need to support each other to cope with this. At AfPP, the headquarters team are also working really hard to support members. We're keeping you up to date with information about changes to guidelines and research. This is new to all of us, and such advice is changing daily. We're still providing the professional advice service and the legal helpline to help you through this. Please utilise those. We're always here to listen to you. One of our members recently said to me that she wanted me to promote hope, and I totally agree with this. We need hope. Abraham Lincoln said, "I do the very best I know how, the very best I can, and I mean to keep doing this until the end." This is all we can hope to do, and I think this is our mantra. So I thank you all for everything you are doing. You are a fantastic team. We are a fantastic team. So let's celebrate life, but take time to remember those we've lost. Above all, I ask you please take care and stay safe. We will get through this together.